Well, many of you have asked us about this case for weeks. It's even gone viral on social media. And after weeks of asking lots of questions, WIS has now confirmed that an almost always fatal amoeba has been reported in our community. The South Carolina Department of Public Health now confirming this case to WIS.
They say it happened about 2 weeks ago right here in the Midlands, and the victim died from the amoeba.
So why no safety alert? Our Derek Rush has been digging into this today. Derek, I know you've spoken with the Department of Public Health and other experts. And listen, we've been told that there were HIPAA laws. We didn't ask for any privacy information. We just wanted to confirm if this case was in our community. That's all we were asking.
I think let me be very specific. The Department of Public Health very clearly saying that any information beyond what we've received today would be a risk for people's information being shared due to some of the information that we have seen go viral on social media. Now, the amoeba lives in water and can only infect the person through the nose, but data on the infection is limited because cases are just that rare.
A patient that recently was in our hospital who passed away from Naegleria fowleri.
Prisma Health Children's Hospital and the Department of Public Health both confirming a brain-eating amoeba case reported in the Midlands.
To the family, that we send our condolences to you.
The case sparking safety questions that I took to health experts across the Midlands.
Yeah, so it really is a needle in a haystack kind of situation.
Dr. Melissa Nolan with USC School of Public Health says the infection happens when warm, fresh water carrying the amoeba makes contact with the brain. But it's rare, so rare, the CDC says only 167 cases have been reported nationwide in the past 62 years. The South Carolina Department of Public Health says that the case was reported 2 weeks ago. When I asked why the case wasn't reported immediately, state epidemiologist Dr. Linda Bell explained they don't have to.
We don't comment on the individual case. This is not an organism that we do surveillance for.
Bell says that South Carolina agencies are not required to issue an announcement when a case like this occurs, nor are they required to test water for amoebas. But despite the rare history of infection, experts still recommend precaution when swimming in warm, fresh water to prevent the risk of infection.
Completely understand. We love being out there. This is the time of year we want to be out there. I would caution you, again, when that lake water gets above 80 degrees and it's warm for several days in a row, just try and be cautious. Maybe keep your head above water, gently jump into it, hold your nose, use a nose clip if you can, or again, maybe go to the pools for the next few days. We know that those are going to be safe.
Epidemiologists say you should specifically avoid stirring up sediment in water that is warmer than 80 degrees, and more specifically water that is fresh bodies of water that are more than 80 degrees. Hannah?
Derek, thank you. Now, DPH also says this is the only brain-eating amoeba case reported to them in the last 9 years.